Conference. It's time for our second session for day 2. And today I can't think of a more important topic to dive into than sustainable living, cultivating better lifestyle for a brighter future. So today we have a remarkable expert to guide us through this crucial topic and share the wisdom needed to cultivate a better, more sustainable future. The session will be chaired by the distinguished Dr. Vishwanath Biradar Sir, Professor and Vice Principal at MGM Mother Teresa College of Nursing, Aurangabad. I welcome you, sir, to the stage. And to guide us through this meaningful session, we have Ms. Priyanka Mekwan ma'am, Assistant Professor at CVM Nursing College, CVM University, Anand, as our moderator. I welcome you, ma'am, to come forward to the stage. Let's give them a big round of applause. Ms. Priyanka Mekwan ma'am is an assistant professor at CVM Nursing College, the Charutar Vidya Mandal, CVM University, Anand. Ma'am holds a master's degree in obstetrics and gynecological nursing from Charusat University with a strong focus on research and holistic care. Her postgraduate research centered on a topic that highlights her interest in holistic and evidence-based care in women's health. Ma'am is also certified in guided imagery therapy as part of her advanced training. Ma'am has also taken on roles such as examination committee, student moderator, and external examiner. She has published research in reputed journals and actively participated in various national workshops and conferences. A passionate educator and advocate of evidence-based nursing, Ms. Mekwan ma'am continues to make significant contributions to nursing education and women's health. Now, without further delay, I'd like to hand over the stage to Ms. Priyanka Mekwan ma'am, our moderator, to lead us into this vital discussion on sustainable living. Ma'am, the stage is yours.
Good morning, everyone. So, as a moderator of this session, I would like to introduce our session's chairperson, Dr. Vishwanath Biradar Sir. Sir is a professor cum vice principal at the MGM Mother Teresa College of Nursing. Sir has over 60 years of experience in nursing education, research and administration. Sir is a PhD graduate from MGM Institute of Health and Science. And Sir also actively serves as a board of search studies for several universities and has a lead quality of initiative as a NAEC and IQAC coordinators. Sir has published and presented over 20 papers of national and the international conferences and also received an award for the base paper and the poster presentation. Sir is hold the editorial role in a reputed journal and has completed advanced training in a simulation-based education and research methodology. Sir is a member of the professional body like a TNAI and the Critical Care Nurses Society and the contribution as an examiner, paper setter and also the inspection committee chairperson. Sir, we are grateful for your presence today and also I welcome you for this session to chair this session. Sir, welcome you, sir, on the stage.
Greetings to CVM Nursing College and SOCHNI for organizing this wonderful international conference from our own institute, MGM Mother Teresa College of Nursing, Chhatrapati Sambhajinagar. Good morning, one and all. It's my pleasure to chair the session. It's my time to introduce our today's speaker. It's privilege to introduce distinguished personality whose work beautifully bridges the realms of modern medicine and holistic well-being. That is none other than Dr. Balendu S. Vaishnav. Dr. Vaishnav sir is professor and head of Department of Medicine at Pramukh Swami Medical College and Sri Krishna Hospital, Baikaka University, Gujarat. He also serves as chairperson of the Sri Aurobindo Chair of Integral Studies at Sardar Patel University. This itself reflects that his deep commitment to integrating spiritual wisdom into the education and healthcare. With a career spanning of 35 years, Dr. Vaishnav has mentored more than 20 MD and 5 PhD scholars, focusing on diverse and enriching areas such as spirituality, meditation, and integral health. He holds an MD in medicine and postgraduate diploma in holistic healthcare. And this itself reflects his dedication to comprehensive view of healing. During the COVID-19 pandemic, he served as the nodal officer of designated hospital, showing exceptional leadership in the time of crisis. Dr. Vaishnav sir is a prolific contributor to the academic and public discourse with more than 35 publications, participation in over 125 conferences and workshops, and he is also having editorial stewardship of 179 issues of the inspirational e-magazine, that is the Sunlit Path. As we explore the theme sustainable living, cultivating better lifestyles for the brighter future, there is there is no better voice to guide us than the Dr. Vaishnav. Please join me in the warm welcoming of Dr. Balendu Vaishnav sir for delivering this session.
Namaste. At the outset, I express my gratitude to the organizing chairperson, organizing secretary, and the CVM Institute for giving me this opportunity. Distinguished chairpersons, I'll be talking on this topic, cultivating better lifestyle for better future. And this is the session outline. I'll touch upon the SDG goals very cursorily, then talk about changing global disease scenario landscape, key points of lifestyle management, and nurses as catalysts of healthier future, and something about meditation and relaxation. As we know, it's like revisiting our aspiration for a better life. Whether it's an individual, whether it's a nation, whether it is world, it's same vision, same aspiration. We are putting it again and again in different words. And the Sustainable Developmental Goals have many out of the 30 which are related to healthy life of individuals, whether it is gender, whether it is climate, whether it is mental health, whether it is healthier workplace balance, etc. But we will focus on health related issues. We will be directly on the task. You see, the landscape is changing of the diseases. We don't have many diarrheas and dysenteries and smallpox and chickenpox, but we have many more diabetes and hypertension and asthma and malignancy. So chronic diseases, heart disease, they are now the leading cause of death. And behind them, we have preventable factors like diet, exercise, stress management. So the landscape is different. There is a greater awareness and recognition about mental health and holistic well-being. I think the next slide explains it more elaborately. Because the landscape is changing, our approach from a reactive approach is moving to a proactive approach. If I have got some infection, I will react, diagnose, treat. But For hypertension, I can't do that. I have to do something which prevents hypertension. So from a reactive approach, I have to move to proactive approach. पानी पहला पार बांधवी. That is what is proactive approach. Preventive healthcare is also rising. Vaccination, screening, health checkup, lifestyle coaching, it's gaining importance. Whether online or offline, we have so many courses, so many sessions, so many classes for preventive approaches. And promotive, not only preventive. I'll become better. My exercise tolerance has improved. My BMI has reduced. My bone density has improved. So it is becoming promotive health care. And lastly, spiritual care and yoga are finding greater acceptance. Now we have, it's mentioned in our textbooks. When I was a student like you, it was considered as a taboo. Don't speak about yoga. Don't speak about spirituality. It is after class, after 5 o'clock. Ashram, 7 साल होने के बाद आप जाना spirituality के लिए. Not today. Even student of first standard is taught. Again, I am saying the same thing, but to convey the point well, the last century, say 1950 to 2000, or 1930 to 2000, the landscape had many infectious diseases. And if the diseases are many diseases are infectious, we need a disease elimination model. Smallpox आया उसको निकालो, chickenpox आया उसको निकालो, measles को निकालो, mumps को निकालो. Disease है उसको eliminate करो, eliminate the disease. Therefore, environmental sanitation, hygiene, asepsis, antisepsis, antimicrobial approaches, vaccination, they all grew. It was need of the day. When there were very few phones, they grew STDs, STD PCO. It was need of the day. Then came, because then some certain level of hygiene has been achieved, things are better in many parts of the world. They are cleaner, more hygienic. Everybody is using Bisleri water, many of them. So infections have been addressed to a reasonable extent or large extent. But then, because of urbanization, non-communicable disease आ गए. We took care of the infections, but only to be replaced because urbanization, busy duty, stress, fast food, refined food. So non-communicable diseases came. When the non-communicable diseases were many, people said that the non-communicable diseases are because of your lifestyle is wrong. You are not walking, you are not resting, you are eating too much of fast food, you are in great competition, you are in great stress. So then people say that, oh, my cholesterol is high, my BMI is high, my vitamin D3 is less. So the focus shifted from cleanliness. I mean, it was added, cleanliness remained, but it was added by focus on healthy lifestyle, screening, monitoring, control of physical, biochemical and psychological parameters. Even our watch will say how much is your stress level. I said, come on, this watch tells me that how much is your stress level. It has come now. No STDs, only mobile, only smart watches, and they will tell how much is your exercise. They will tell, if I walk more, they will say, okay, congratulations, you have achieved. They are monitoring. They are guiding. And then health checkup. Now we have got ours is a middle level institution, but you go to 5-star institutions in metros. Health checkup schemes will be up from 5,000 to 50,000, 1 lakh rupees. You go there for 2 days, go empty stomach, and one consultant, second, third, fourth, they will do your health checkup. Pura analysis kar denge. They will give you a good deluxe room to stay, shoot if you have more money. And then after 2 days you go back with a very good suitcase or a bag, plastic folder. It says that we have done 300 tests in you, they are all normal. Only 2 things are abnormal. So you instantly become happy, you know, you have spent 15,000 rupees or 30,000 rupees. The moment you reach your home or the moment you reach your workplace, no issue, WhatsApp and this and that. So we have to achieve physical health, no question about it. We have to achieve biochemical health, no question about it. Our cholesterol should be normal, HbA1c should be normal, B12 should be normal, D3 should be, there is no question, undeniable. But that is not health. You ask an executive whose all reports are green, are you happy? He will say, no, I am not happy. My biochemistry is happy. I mean healthy. My physics is healthy. I am not healthy. Let me tell you very honestly. Shanti nahi hai. जैसे बात करेंगे कम्युनिटी में, हाँ मेरा हेल्थ चेकअप हो गया, सब कुछ नॉर्मल है. But then that is not totality. So now the next model which is growing is growth in being model. You grow from within. Feel happy. Feel blessed. Feel quiet. That is health. Without that, health is not good. It is incomplete. So if you change the style of your life, it will make you well. Naturally, it is necessary. But if you change the aim of your life, it will make you well-being. There is a difference between wellness and well-being. Wellness is whatever is seen. It's like dressing. It's all good things. But well-being is to be happy from within. So the focus is shifting from wellness to well-being. The focus is, we need outer means of healing. We need everything. But the focus is shifting from outer means to inner means of healing. Now well-being, so thus said, it means that well-being is based on entirety. सब बता दें आप कैसे फील कर रहे हैं. In totality, how are you feeling? It incorporates positive outlook on life, happiness, resilience, positive emotions, relationship with others, and most importantly, expression of one's potential. If you get an opportunity to do something which is your capacity, then you don't need anything else to become happy. Whether you are a student, or a faculty, or an old man. My capacity is this much. If I can express, I am very happy. Expression of one's potential. It's a unifying concept of hedonic and eudaimonic well-being. Hedonic means I am happy with my comforts, and eudaimonic means I am happy with my aspirations, my goals. But Indian psychology says that well-being means ascension to a higher state of existence or being, manifestation of a transcendent state of awareness. It means to become saintly. To go to a level which is higher than common and that every human being is capable of becoming. It comes by kindness, it comes by empathy, it comes by love, it comes by self-giving, it comes by many things. It comes by basically doing something good. And well-being, now why we selected this topic? Well-being has strong influence on genesis, prevention, self-care, treatment, complications and outcome of many diseases. If somebody is well, he may not get disease. By chance he gets disease, his course is different. By chance he gets complications, his outcome is different. By chance he has got worse outcome, his outlook is different. So well-being is very, very important. Now, you know that when we talk about wellness and healthy lifestyle, I will not go in much detail, I will say only few things. तो हमें पता है कि भाई खाने में क्या लेना क्या नहीं लेना उसका लिस्ट आ जाएगा, एक्सरसाइज कैसे करनी है उसका लिस्ट आ जाएगा, स्लीप कैसी होनी चाहिए ऐसा आना वो आ जाएगा, गो फॉर ए वॉक, डोंट स्ट्रेस ऐसा. बट देन इट इन आवर इंडियन terms it consists of, sorry, this is not showing the okay, right, sorry, I'm so sorry for that. So it is our ahar, vihar, achar and vichar. You put a whole volume of wellness and you put these four things on the other side, this will weigh heavily. हमारा आहार कैसा है, हमारा विहार कैसा है, हमारा आचार कैसा है, हमारा विचार कैसा है. Now before we do further, because this you know, everybody knows that salt should be less, oil should be less, you should walk, you should sleep well, you should control weight, don't become angry. It's so easy to say, no? Don't become angry. ऐसा थोड़ा होता है, don't become angry से don't become angry थोड़ा होता है. Far from it. आप 5 बार बोलेंगे means you are 5 miles away from not becoming angry. So but before we discuss that, whatever is the advice that we can give, any nurse can give, the patient is very receptive. I mean, he said that when they hit the iron when it is hot, the patient हमारे पास आता है, then you give a right advice, he will absorb very quickly. Nurses can be catalysts. उनसे मुंह से बोला फिर काम हो गया, डॉक्टर से मुंह से बोला वो काम हो गया. वो होर्डिंग पे लिखा है हजारों लोग देखेंगे, लेकिन मेरा चेक करने गया, किसी ने बताया, डिस्चार्ज के टाइम नर्स ने बताया, वो काम हो गया. उस दिन आपने बताया था वो मैं कर रहा हूँ. So nurses educating patients when they are hospitalized, its effect goes beyond hospitalization and helps them to better lifestyle outcomes. It can influence public health, education and policy. It can educate patients on diverse lifestyle factors, nutrition, immunization, mental health, training, exercise, etc. It will help in community engagement and in future probably. The previous speaker told about tele consultation. Maybe we are still not up to that, but it can help in a digitized world in telemedicine. Now I will say something about all the common advices. Probably you might be knowing or I have selected only few things, but it will be helpful. It is known that 11 minutes of exercise will reduce this risk of death by 25%. तो अगर आपको ऐसा करना है तो चलो 11 minutes, बस हो गया. We are not telling you कि walk 45 minutes. कोई जाएगा नहीं, 5 दिन जाएगा फिर 15 दिन नहीं जाएगा. So tell the patient that walk for 11 minutes. 25% reduction in death. Who will not like it? It makes one less sensitive to pain. It boosts mood and help reduce feeling of stress and depression. It will enhance the quality of life, and it can help in preventing obesity, coronary artery disease and Alzheimer's disease. Now, how much to exercise? The standard literature says that 150 minutes of moderate intensity or 75 minutes of vigorous for cardiac nourishment or cardiac care, and twice in a week strength training with yogasana for flexibility and balance. Which type of exercise? Slow or fast? For many decades it was believed that yogasana is not an exercise. It is just bending and posture. But now science has proved that when you do a slow exercise, slow breathing, slow postures, it has better benefits. Because fast exercise, achieving a certain max or target heart rate is geared up to help you to be prepared for a fight and flight response. It increases your stamina, but when you only deep breathing, shavasana, that will help you, that will produce autonomic modulation. It will improve the mental balance and physical balance. So yogasana has not only physical benefits, it has psychological and spiritual benefits as well. 5 to 7% weight reduction will again reduce the risk of diabetes by 60%. It will help in reduction in blood pressure, dyslipidemia, obesity, inflammation. It will improve sleep quality and reduce symptoms of obstructive sleep apnea. It will improve fertility and reproductive health. Now, how to reduce weight? One is behavioral weight management programs and structural intervention. And you go to a programmer and he will give you the diet plan, he will give you the exercise plan, and then you do it. Second is to do caloric restriction. Intermittent fasting, it is very good. You see, when you do intermittent fasting, you are only skipping your breakfast. Lunch you can take whatever you want to take. You slowly reduce. High protein diet, processed foods contribute to obesity, reduce added sugar. तो आहार और विहार साथ में जाते हैं. Only diet will not help. Diet has to be combined with exercise. Then it will help. Mindful eating, आहार विहार only दो साथ में नहीं जाते हैं. उसके साथ आचार भी चाहिए. आचार means not pickles. Achar means our way we work, the way we work in our family, the way we work in our job, competition, all self-management. Now salt. I would like to say something about salt. It is said that salt causes hypertension. True. So suppose it is true that every human being, when his age increases, blood pressure will increase. So from 130, at the age of 30 years, suppose it's 130, at the age of 50 years, it will become 145 or 150. Normal aging. But if somebody is taking extra salt, it will be more. So if you reduce salt, then age-related blood pressure also will not be same. Sometimes you find people who are 80 years and blood pressure is 110 because there are many factors, but one of them is reduction in salt. It will reduce the, somebody says क्या थोड़ा तो salt control करता हूँ लेकिन blood pressure control नहीं आता है. The antihypertensive medicine will be not effective if somebody continues to take salt. For a given degree of blood pressure, the higher rate of complication if person is taking salt. And sometimes we find somebody has no hypertension, no diabetes, but still why did he get stroke, why did he get MI? So salt alone will also give rise to target organ damage. It's not salt causing hypertension, causing heart attack, this is one. But salt, but no hypertension, still heart attack, it is also common. Now this was a long-term study, long-term back. It was a UK PDS study. And किसी ने पूछा कि डॉक्टर साहब मुझे तो डायबिटीज भी है और हाइपरटेंशन भी है. Listen it carefully. Listen up to the end. वो आता है ना वीडियो में, यूट्यूब में, watch to the end. So listen to the end whatever I am saying. तो किसी ने बोला साहब मेरे को तो हाइपरटेंशन भी है, डायबिटीज है. आप बोल रहे हैं कि नमक मत खाओ, शुगर मत खाओ, क्या खाओ? नहीं, no salt, no sugar. Then he was a scientist. Then he said that अगर खाना ही है तो शुगर खाओ. Salt is more harmful than sugar. इसका मतलब ये नहीं है, now listen to the end. इसका मतलब ये नहीं है कि you got a freedom, you got diabetes happen and you go on eating sugar. No, it will also cost you. But out of the two, salt is more harmful, more dangerous. It will cause immediate death, and diabetes will cause death after 2 decades. So of the two, salt is more poisonous. It's a limited message that I would like to tell you. Please don't misunderstand. Sugar is not like free. Sugar is not harmless. Sugar is also harmful, but as compared to salt, sugar is less harmful. We know the hazards of excess of sugar. Obesity, hypertension, diabetes, we know, but liver damage and fatty liver is also rising now. Sleep. I often teach my patients that in this era, probably it is true for everybody, all of us, the moment we get up, the day is not in our hand. WhatsApp, call for those who are working in their home, वो काम वाली नहीं आई, ये नहीं आया, पानी नहीं आया. Those who are working in office, they have their own problems. The only thing that we can do is to work on our sleep. If you can relax properly, pray properly, sleep properly, those 8 hours, the body will recoup completely. That is the only thing which we have in our universal. The world is very small. You open the WhatsApp and you get the news and everything. If you can, वो साधना है. If you can manage a good sleep, whether you are a student or an executive, if your sleep is very sound, then many diseases will not touch you. It is very, very important. Because you might have to take food in your hospital, you might not get time to go to for a walk. You might be living in a metro where there is a lot of pollution. You have a stress of your children's school fees and exams. So once you wake up, your life is influenced by external factors. So साधना करनी चाहिए हमें अच्छी sleep की. When you are sleeping very nicely, your body is relaxed, your autonomic system is relaxed, inflammation is less, vascular stress is less, body recovers. हम पौधे में पानी डालते हैं, वो मुरझा गया तो कैसा खिलता है. We should have good sleep. Now we all know that type A personality is very harmful, no? One who is a hyper type of person. It is all well known. Anxious, in competition, in hurry, motivation, impatience, aggressive, hostile. But it is also known that type B is also harmful. वो कोई आदमी किसी से बोलेगा नहीं, अकेला अकेला रहेगा, डिप्रेस रहेगा, he doesn't express himself, that is type D. That also is responsible for heart attack. So heart attack, feelings of worry, sadness, fear of rejection, pessimistic outlook, hopelessness, lack of self-confidence, negative self-talk, they also produce heart attack. It's not one who is very angry will get heart attack. One who is very depressed also will get heart attack. હવે એમ કે આ માણસ તો કેવો શાંત હતો, બોલતો નહોતો, સુનમુન કહેતો, એને કેમ હાર્ટ એટેક આવ્યો? Because he type D personality. This is a graph I would like all of you to look at it. It says that, let us see the first one only. Every disease will add the risk factors. First of all is age. तो भगवान ने हमें सभी को, when we are born, God has given us 100 years. सर्टिफिकेट तो दे दिया है कि भाई आपका चेकआउट टाइम 100 years के बाद है, सभी को. फिर बोला कि भाई अगर आप ओबेसिटी है तो 10 साल कट जाएंगे. और ओबेसिटी के साथ डायबिटीज है तो और 10 साल कट जाएंगे, 20 साल कट गए. उसके साथ अगर आप एंग्री टाइप ऑफ पर्सन है तो 5 years और कट जाएंगे. और आप स्मोकिंग करते हैं तो फिर और 10 साल कम हो गए. हाइपरटेंशन हुआ तो सब कटिंग होके 50 आ जाएगा. And they come in groups, no? No, we have those beautiful travel SOTC, and if you go with family, the child gets free. No, if you book before March for a May, then you can go to Dubai as well. You see, all such things come. So अगर आपको ऐसी lifestyle है, then everything will come. हाइपरटेंशन आएगा, उसके साथ सब बंदे आ जाएंगे, सब बंदर आ जाएंगे. डायबिटीज, ओबेसिटी, स्मोकिंग, स्ट्रेस, एवरीथिंग, एंड एवरीथिंग विल एड ऑन. सो वन शुड बी केयरफुल. Nurse is a spiritual care provider. Before that, I will move on this. Now I think I have. But this is the third part that I am coming. Now I have 5 minutes. ऐसे नहीं होता है वेलनेस. कोलेस्ट्रॉल ठीक करो, सॉल्ट ठीक करो, 10,000 स्टेप करो, ऐसे वेलनेस नहीं होता है. वेलनेस इज एन इनर थिंग. Wellness is not based on, it's not external. Peace, bliss. You ask anybody. There are children, you ask your parents will not speak. But you ask a person, कि आपको हाइपरटेंशन कब से हुआ? तो मेरे बच्चे का एडमिशन का प्रॉब्लम तब से मुझे हाइपरटेंशन हुआ. I'm walking, I'm taking care of my diet. The psychological factors are more दे आर नॉट विजिबल बट दे आर दैट वेलनेस में ये आना चाहिए. वो स्ट्रगल तो सभी को होती है, सभी को एडमिशन का प्रॉब्लम होता है. सो वी हैव टू डेवलप एन इनर रेजिलियंस, पीस, ब्लिस, कंटेंटेडनेस, बैलेंस एंड एस्पिरेशन, फेथ एंड प्रेयर. इससे वेलनेस आती है. इन दिस द नर्सेज हु कैन प्रोवाइड द स्पिरिचुअल वेल-बीइंग, दे शुड फोकस ऑन दिस. They should focus for themselves and they should focus for patients. Now the first photograph is you cannot make out some construction is going on, no? It's very haphazard and dirty and not very beautiful. And the second photograph is of a beautiful world famous Eiffel Tower. Now the first photograph is the foundation of Eiffel Tower. जो फाउंडेशन में रहती है चीज वो बाहर नहीं दिखती है, वो हेल्थ चेकअप में नहीं आती है. फाउंडेशन में रहता है ये है पीस, हैप्पीनेस, ब्लिस, क्वाइट्यूड, फॉरगिवनेस, ability to laugh at the situation. वो है वहाँ हमारा vascular stress, endothelial stress starts at that level. It doesn't start by eating 2 more pakoras. No, it starts because we are angry. It starts because we are stressed. वहाँ से शुरू होती है. The subtle is more important than the gross. Now this is, I think, last 2 slides. I noticed a child monk. He can't have been more than 10 years old. He was teaching a group of 5 years. Now all of you can do also. You are also students. This 10-year boy was teaching a 5-year student. He had a group teaching. He had a great aura around him. The poise and confidence of an adult. What are you doing? I asked. We just taught them their first class ever. पहला उनके शिक्षा पढ़ाई, फर्स्ट लेसन. हम स्कूल में जाते हैं, प्री केजी में बच्चों को भेजते हैं. Then the person says, I learnt in my first class the alphabet and numbers. What did they learn? The person who is asking them, he says कि मैंने तो पहले क्लास में ABCD सीखा और 1 2 3 4 सीखा. What did you teach? What did they learn? He said the first thing we teach them is how to breathe. Why breathe? Because the only thing that stays with you from the moment you are born until you are dead is your breath. All your friends, all your family, country you live in, all of them can change. The one thing that always stays with your breath. Then 10-year-old added that when you get stressed, what changes your breath? When you get angry, what changes your breath? When you experience every emotion with change of your breath. So when you learn to navigate your breath and manage your breath, then you can navigate any situation in your life. We are talking of foundation of health, foundation of wellness. Foundation of wellness starts with navigating or observing your breath, remaining quiet. Inhale the beauty, exhale the gratitude. And this is a revolution. The world knows 3 types of revolution. The material has strong results. What we said about infectious disease, great. The moral and intellectual are infinitely larger in their scope. All the organization and protocols and SOPs and guidelines and everything. But spiritual are great sowings. वो दिखते नहीं है, वो अंदर रहते हैं. हम बीज बोते हैं, ऐसे अंदर रहते हैं. It will grow in our students. it will grow the next generation. Because this bodily appearance is not, we are talking of fourth dimension now. This bodily appearance is not all. What we call as a physical, social, psychological human being is not all. We are a spiritual being. The form deceives. The person is a mask. With deep in man, celestial powers can dwell, and incognito of the imperishable. हमारे अंदर एक दिव्य शक्ति रही है, उसके आधार में हम जो भी करेंगे, जैसे भी शुरुआत करेंगे, हमारे आहार, विहार, आचार, विचार सब में उसका लाइट आएगा. थैंक यू.
Thank you, Dr. Vaishnav sir. It was a very insightful and impactful session on needy topic, I can say. Holistic health is very much important in our life. Sir has given wonderful session with relevant real-time examples. As sir has mentioned, just I will highlight some of the points. In that, sir mentioned about there are number of increase in the chronic diseases. Landscape of disease is changing. Then there is a very much importance of mental health than the physical health and other health. All health are important, but we are lessly giving importance to the mental health. Then, as sir has mentioned, our take home away message will be 4 things. We must follow the ahar, vihar, achar and vichar. When we follow this, automatically our holistic health will be maintained in a proper way. Now, sir has mentioned about so many lifestyle modification. Each and everyone need to apply this in our day-to-day life. Most of the time we are addicted to yantra, which is called as a mobile, and because of that only there are number of diseases are increasing. And let us follow the what sir has mentioned. With this, we are concluding this session. If any questions are there, it is open for discussion. If any questions from the audience, yes.
Yeah, good one, sir. I really impressed with the quote which you have highlighted, ahar, vihar, achar and vichar. It's really good. Sir, as you said, many times we people are telling don't become anger, don't take the tension. But ultimately I have observed, even the person having a B positive attitude, B positive blood group, but even he do not have B positive. So that's my question, how we are giving them such a way that how he can manage himself. And second thing, sir, what I have heard, there are 3 things which is dangerous. As you said, sugar, salt, and along with that I heard about milk. So what about it, sir? Even milk is also dangerous for us? Or?
No, I think milk is alright. It's a part of normal food, and small hair splitting report should not be taken into consideration. I'll answer about how to control anger. You see, you rise to a level where anger is not natural. Peace descends. You can make a program, I'll not become angry. If I become angry, I'll take deep breath, I'll put my hand in my pocket. These are surface things are alright. But if your life is if you have an aim in life, if you have a mission, then even if some anger comes on the way, it is directed. And gradually there is no other way. The only way is to achieve a state where anger loses its, to begin with, it loses its value, then loses its hold. And then you become different. And I must say that if you practice meditation with aim, not only meditation just becoming quiet, but if you have an aim of spiritual development, then you practice meditation or any spiritual practices, then anger will lose. We have a higher consciousness within us. So a surface thing can do for my weight, it can do for my cholesterol, but it cannot do for my, it becomes a lip service. Mental health protocol will not work. We have to have something which is higher than mind principle. That should rule us. If my soul rules my mind, if my soul rules my thinking, if my soul rules my body, soul rules my, then it happens.
Good morning, sir. Sir, my question on the basis of challenges of adaptation on landscape. How can we strengthen health system to respond emerging threats or upcoming threats from our COVIDs? So, how can we strengthen health system to respond for this emergence threat?
Right, it is happening. You see, I was going to say that whatever I said, we can teach in a classroom, but it starts from our families, it starts from our temples, it starts from our churches. That we become different. There has to be a different doctor, different nurse who is practicing. Then it happens. So we see so many yogas and meditation. It's a society's response. Even it may not come in medical textbook, still people are using it. तो जाना तो चाहिए, हाँ, कपालभाति करना चाहिए, अनुलोम विलोम करना चाहिए. कौन साइंटिस्ट ने बताया? किसी ने नहीं बताया. So society will find out. Life is, we don't have a monopoly. Medical science has no monopoly on the life. So there are outer sources which will help.
Good morning, sir. Myself Vishal from Mother Teresa College of Nursing, Chhatrapati Sambhajinagar. The session is very encouraging for all of us. So my question is, what are the challenges you see in encouraging sustainable lifestyle, and what are the solutions to overcome these challenges? Because there is two aspects always. One is theoretical and one is practical. So what are the practical aspects to overcome these challenges?
Challenge is that we should not be confined with outer forms only. We will have so many health activities and we will be happy for a short time, but then. And the way is to become conscious of the fourth dimension. The whole world is moving towards that. So this is 2025 and 2050. It will be part of every teaching. We are ahead of time in saying that the fourth dimension should be part of our teaching. Without that, there is no. You see a saint, he doesn't have best of laboratory features, but he is in equilibrium with himself. He is growing in equilibrium. That is education. No, last slide, no? Breathing. Are we teaching breathing? No. We start teaching breathing, children will become different.
Thank you, sir.
Thank you, sir, for this wonderful session. Herewith we are ending this session. Once again, from on behalf of organizing committee, I thank you.
So please wait and sit just a minute. Thank you so much, sir, for your insightful session. As we draw this session to a close, it's time for us to express our heartfelt gratitude to the distinguished individuals who made this session truly special. First and foremost, may I request Dr. Vishwanath Biradar, sir, and Ms. Priyanka Magwan, ma'am, to present a small token of appreciation with memento and certificate to Dr. Bhalendu S. Vaishnav, sir, Professor, Department of Medicine, Bhaikaka University. sir. The session was absolutely enlightening. Your an invaluable contribution and for inspiring us all to rethink our approach to a better future. Next, we extend our sincere thanks to our esteemed chairperson, Dr. Vishwanath Biradar, sir. We truly appreciate your support. We are grateful for your presence here with us today. I kindly request Ms. Priyanka Megwan ma'am to present a memento and certificate of appreciation to sir. We also would like to extend our thanks to our moderator, Ms. Priyanka Megwan ma'am. Your excellent guiding this session very smoothly. We are grateful for your efforts. May I now invite Professor Sidram Sarate sir to present ma'am with memento and certificate of appreciation for her contributions and dedication. Once again, a warm thank you to our outstanding speaker, chairperson and moderator for making this session both impactful and memorable. Thank you so much all.